Hi, I'm Dr. Peter Petropoulos from Potomac Medical Aesthetics. Today I'm going to talk to you about the vampire facelift procedure. You may have heard of the vampire facelift. You may have also heard of the vampire facial. These are two separate procedures, different procedures for different purposes. If you're interested in the vampire facial procedure, there's definitely a great web page on our website as well as YouTube that goes into the details of that procedure. But I'm going to talk about the facelift. The facelift is designed for patients that have a combination of concerns. Typically it's for patients who are looking to improve the color of their skin, if there's like a graying or an overall discoloration of the skin, and also loss of volume in the face with sagging skin, darkness under the eyes, with circles forming under the eyes, and just an overall droopiness of the face, a tired look. And maybe some skin texture issues. So really, those are the concerns that the vampire facelift will address. So what is it? The vampire facelift is a procedure that we do by combining hyaluronic acid, or an HA filler. We use Juvederm Ultra Plus as our filler, which is an injectable that actually brings volume to the face, and then we combine it with PRP, or platelet-rich plasma, which allows for even further growth of collagen and blood vessels, giving a lot of desired benefits. The filler gives us an instant fullness that we're looking for in strategic areas of the face, and then the PRP kicks in to give even more results as far as collagen and blood vessel production. So they work together very well. So you may have tried other procedures to try to address these concerns, things like Botox or chemical peels, laser and light therapies that may have worked or may have not given as much results as you were hoping for. So by combining filler and PRP, we may be able to give you the results you're looking for. So how do we do it? Well, we apply a topical anesthetic to the face, typically for about 45 minutes, so that the patient doesn't feel much. Then we draw the blood while your face is under local anesthetic. We draw the blood with local anesthetic in place to the arm too, to get your blood. And then we take it to the centrifuge, spin down the blood to extract the PRP, or the platelet-rich plasma. And then we follow the protocol set by Dr. Runnels, who is the inventor of the vampire facelift. So we follow his technique to make sure we get the best results. So PRP contains growth factors that stimulates growth of collagen and new blood vessels. So alone, it has effect on creating some volume, but when we combine it with filler, we get even greater effects. So adding the PRP gives us better changes in color and texture than filler alone can give. We can also put PRP in the tear troughs to try to give some fullness and improve the discoloration. And it's actually a lot safer than putting filler in the tear troughs. Overall, the effect that we get from the vampire facelift is a refreshed look, younger appearing skin. Some of the effects are instant from injecting the filler. But then other effects that we get from the PRP typically take 2 to 3 weeks to start and maximize at 2 to 3 months. And then we see effects for about 1 to 2 years, and then we typically will repeat the procedure as needed. So the reason that we do a consultation is to make sure that this is the right procedure for you. So if you're looking for a procedure that's going to improve the skin color, improve some of the problem spots like depths in the what we call the nasolabial folds, loss of volume or depression right in this area, dark circles, as well as in the corners of the mouth, the vampire facelift is great. So what it's not a procedure that's going to replace surgery. So there are some patients that have some severe wrinkling of the skin or volume loss that surgery might be the best option, and so that's why we like to evaluate every patient to make sure it's the right procedure. We may have to refer some patients out for surgery that are not a good candidate for this procedure. Some patients might just need Botox for some wrinkles that are addressed best by Botox, and some patients might just need filler alone. The consultation will really let us give you the best recommendations. So if you've got any of the concerns I talked about, or you have somebody that you know that's got this concern, have them give us a call. We'd love to sit down and talk to you about the vampire facelift and see if it may be the right procedure for you. Thanks for your time. Thanks for watching.